We'll go ahead and get started. I think we have everyone we need. Great. So as we all know, COVID has had a global effect on how researchers can be nimble and adaptive, but still maintain data quality and reliability. Collectively, we've had to rethink remote data collection methods alongside which research questions and which implementation strategies can actually make the pivot to a digital world. For the 4 organizations present today, whose work is steeped in research to avail scientific evidence for effective solutions across different parts of the world, this was, of course, a head scratcher. To continue to meet our missions, we realized that research must overcome exogenous barriers such as COVID and push through. So we shifted our focus to studying how we can make these remote methods most effective. Our studies and efforts have yielded some interesting and hopefully useful results, which we only realized when we'd meet informally amongst us. So today we're hoping that some of the learnings from our similar challenges and potentially different approaches could help some of you who've joined today make your upcoming research smoother. Just a note on housekeeping and formats. Similar to other webinar formats, we'll start by hearing from our panelists today on their research insights, takeaways. We'll then move to a discussion section and invite questions from all of you. Please use the Q&A feature on your Zoom screen at the bottom to send in your questions. You can send these in at any time, of course, but we do have some dedicated time at the end to address them. In addition, if you have any clarification questions or questions for specific organizations, please feel free to put them in the chat during the presentation as well. Each organization has a representative on the panel today who can address some of these questions via chat as we go along. We'll close the session by hearing some thoughts on future directions from the panelists, which will hopefully leave all of us with some food for thought for the day. So with that, I think we'll start off with our panel. As researchers have been contemplating remote research, there is a small toolbox of options as to modes that are available to collect data. These can be phone, SMS, IVR, applications, and so on. The starting point is to determine which mode of research remote research suits the research question, as well as can glean high quality data. So to kick us off, Nicholas and Dhwani, I'll start with you. As researchers at Busara that focus on leveraging insights from behavioral science in pursuit of poverty alleviation, a key part of your portfolios focuses on understanding behavior and research on research to uncover why participants respond the way they do and how that can be optimized. What have you guys found on how different survey modes such as phone and SMS compare, and where are the differences? What have some of your larger learning been? We'd love to hear your insights on that. Nicholas, Dhwani.
Hi. So the question specifically are larger insights regarding people's behaviors in relation to applying remote methods. Precisely.
Yeah, go ahead. Start with you.
Sure. I think some of the things that we have that we've most notably been trying to assess is what kinds of people are more likely to respond to different methods and modes. As you're going to see throughout this presentation, different modes are going to yield different response rates. And what that's going to mean is that you're getting a non-response. You're getting a group of people that are not responding to certain modes and methods. And that is going to mean that slightly different reasons are going to come to the fore for why people are responding and why people are not responding. Phone surveys, for example, you're typically going to see, I know IPA will get more into this, but you're typically going to see about half the people that you make attempts to survey responding. And SMS is going to be more along the lines of between 10 and 20% from predetermined call lists. Now, people essentially are going to have different motivations for participating in research, whether they be extrinsic or intrinsic. And these are some of the questions that we're going to start to be toying with. which is why we are varying such things as incentives to participate. So for example, if you're adding an incentive, creating an extrinsic motivation to participate, are you getting differences in response rates? Are you getting different types of people responding as well? Because it's going to essentially be people that might be more extrinsically motivated to respond. And what's that going to mean for the sample that you get at the end of the day? And what's that going to mean for responses? Well, what we're also encountering is that some of these are going to be self-administered modes, such as web surveys and SMS surveys. And so they're going to be prone to sort of other features of human behavior, such as time preferences, for example. If somebody has the option to not respond immediately, but might delay when they submit the survey, in an SMS survey, for example, they could submit it immediately, or they could submit it in several hours' time. And so the question is, how do we deal with people's impatience, or how do we deal with people's different time preferences? And what window do we allow to respond? People might also do a survey at a time that might be convenient to them, but might be where they're inattentive, such as when they're cooking. So do we see differences in responses depending on the time that people do it? Finally, I'll stop now, is another interesting thing that we're very keen on looking at is that like I said, you get self-administered and enumerator-led remote surveys. And this might have a difference. This might produce differences in responses because in one case, you're interacting with a human being. In another, you're interacting with an inert interface. And that could produce, for example, differences in social desirability bias when people are responding. So when they're responding to a human being, they might cultivate their answers in such a way as to seem more socially appealing. And so we might see differences in responses because of social reasons, because of potentially social norms and concerns of social desirability. So I'll stop there. We're going to touch on a lot of this as we go on.
Perfect. Thank you for setting the stage. Nenga, do you want to start with the next slide?
Sure thing. Anisha, can you hear me?
Yeah, but Nick is on mute.
Oh, okay.
Right, straight into the presentation then. Sorry. So, hi everyone. Today, me and my colleague Dwani Yagnaraman are going to present the results of two different studies that we conducted at Busara, one in 2017 and one in 2020, that try to determine different aspects of how to conduct a phone and how to conduct an SMS survey, and how different features of the design, such as the incentive amount, such as the framing of questions, the ordering of questions, and how we introduce the survey affect both completion rates and data quality. Next slide, please. So the key takeaways from this are that small incentives seem to make a difference for completion rates in surveys. There's a big difference between a 0 and some positive incentive amount for completion rates, but after a small incentive, less than $1, you don't see significant increases in completion rates. We also find that when we're conducting SMS surveys specifically, that longer SMS surveys could present issues. Firstly, implementation and logistical issues that take pretty long. Secondly, we see order effects in terms of questions that come later in a survey are responded to differently to when they come earlier in a survey. Another one is that when you present a specific break-off point, a point at which you basically dangle the carrot to stop the survey at some midpoint in the survey is a likely opportunity that respondents stop the survey at that point. And then finally, in our mode comparison, where we compared phone and SMS surveys, we found that phone surveys produced, on average, significantly higher quality data, and also had slightly lower selection effects for higher income respondents. Next slide, please. Okay, so the two studies were with us. The first study we conducted in 2017 in partnership with Ajua, and we conducted it exclusively over SMS with low-income respondents with a sample of just over 6,000 people. We randomized the incentive to be either 0, 25 Kenyan shillings, which is approximately 25 US cents, or 100 Kenyan shillings, $1. We also randomized the length of the survey, being a lot of questions around whether people will respond to longer SMS surveys, either 5, 10, or 25 questions. And then we finally randomized whether we disclose the length of the survey and the question order. The study that we conducted last year was a comparison between SMS and phone surveys, where we randomly assigned people to complete the same survey across these two different modes from the same sample pool. And we also randomized the incentive amount, this time between 50 shillings, 150 and 300 shillings. Once again, 50 cents, $1.50 or $3. We also then randomized the question order, the time and day of the survey, and whether or not we sent them an SMS in advance. Next slide, please. So the first thing I'm going to touch on is the incentives. The primary takeaway from this is, once again, that going from a 0 to a positive incentive increases response rates by a meaningful margin, a sufficiently meaningful margin that it seems to be a recommendation. In the second study, we see, however, and in the first study, that increments above this small positive amount in incentive don't seem to affect completion rates, survey completion rates, very much. We saw this in phone surveys, where moving from a 50-cent incentive to a $3 incentive yielded nearly no increase in response rates, which, thank you. Similarly, for the length of the survey, what we found was that while up to the mark of 25 questions, increasing the survey length from 5 questions to 25 questions didn't yield a meaningful decline in completion rates. So what you see is that while there does seem to be a small decline in completion rates for the no incentive condition, when you add a small incentive, this decline in completion rate doesn't seem to have a meaningful impact. And so if your objective is to maximize completion rates for a sort of a lowish cost, then we would, and maximize the amount of data that you can collect, we would recommend a slightly longer SMS survey. Does seem feasible to get this, and with a small incentive increment. Next slide, please. Another pretty clear takeaway was that disclosing the length of the survey in advance yields improved completion rates across our different survey lengths. And quite notably, in fact, for our longer survey, it appears that clearly disclosing the length of the survey in advance yields higher completion rates. This might be unintuitive, but it just seems like it's good practice now to tell respondents how long the survey is going to be before they actually do it. It also seems like a respectful thing to do over and above actually increasing completion rates. Next, please. What we also find is that we do seem to experience order effects in our surveys. What do I mean by order effects? I mean that the position of the question in the survey, whether it comes early in a survey or late in a survey, seems to produce some kind of effect on responses, when obviously, according to, I guess, standard economic theory, this shouldn't cause an adjustment of these kinds of preferences and attitudes. This seems to be most pronounced for SMS surveys, where across a series of like-code questions, people became more agreeable later in a survey. And similarly, this was also an effect that we saw for altruism, according to a hypothetical self-reported altruism measure. This is potentially being underscored by differences in attentiveness across the survey. If you look at the graph on the left, you'll notice that respondents in the SMS surveys got a basic arithmetic question. It was 5 plus 3, incorrect more often later in the survey than earlier in the survey, potentially suggesting that there is lower attention later in the survey, which might be generating these order effects. With the phone survey, we saw across a battery of 5 different attitudinal and preference measures that we did not observe order effects, with the exception of our altruism question. So participants appeared to be more altruistic earlier on in the survey than they were later on in the survey. Earlier on in the survey than they were later on in the survey. And this is a finding that we are planning to replicate in the near future with a larger sample and across other remote data collection modes. So with that, I'll pass it on to my colleague, Dwani.
Yeah, thank you so much, Nick. I'm going to just be jumping into differences between the modes and a discussion of data quality and protocol. So like everyone else interested in doing remote research, we were also very much interested in response rates, especially between phone and SMS surveys. And we tracked this at 3 key points. The first one was the consent at the beginning of the survey. The second one was at a re-consent point around question 20, and you'll see this come up a number of times. And that's where we asked them for consent again before going into some sensitive questions. And lastly, at the end of the survey. And we found that phone survey responses were quite high, with 55% of our sample completing the survey and 45% picking up the phone at the very first call. On the SMS survey, around 1 in 4 people responded. But as the survey progressed, we kept losing respondents. Around 20% dropped off at the 20th question or the re-consent point, and about 50% of our sample dropped off before the end of the survey, leaving our completion rate to about 12%. Next slide, please. So this automatically led us to the question of why there was a consistent break off during these points at SMS surveys. And if you look at the lines in blue, you see that the SMS survey drop off is relatively smooth until we hit that consent point around question 20. And this was because of a number of reasons. The first one was we gave people a really salient opportunity to stop doing the survey. And then we also suggested that there would be something cognitively taxing or sensitive coming up based on how they were interpreting what we were saying to them. And also there were some technical glitches in terms of how our data was being processed by the SMS platform and the way that respondents were looking into this. So we then decided to take into account these technical difficulties and projected the drop-off rate using the red lines, and that's what you're seeing in red and orange. And we found that if we had corrected for these technical errors, we actually would have ended up with a completion rate of about 20% for the SMS survey, which was quite different from what we ended up with. And we found that actually, if there were no technical glitches, we could have had about 57 to about 71%, depending on the incentive, of the population that started the SMS survey would have actually ended up completing it. So doing this analysis taught us to be really wary of reconsenting in the middle of the survey and maybe thinking about moving this to the end of the survey, and also to think about longer surveys for this mid-range incentive of about $1.50. Next slide, please. Yeah, we also then looked into differences between people who completed phone and SMS surveys. So just selection differences between selection effects between the modes and within modes. So we found little evidence of selection effects between SMS and phone completers, mostly on indicators of wealth, which suggested that SMS survey completers on average were richer than their phone counterparts. And between the SMS completers and non-completers, there were many more differences, with significant differences in the categories of wealth, education, and employment. So taken together, this suggests that income-related factors are probably high barriers for taking an SMS survey when compared to a phone survey. So for instance, it might be that SMS surveys are more cognitively taxing, require more resources on the part of the respondent, and this could select for a richer or more educated population who tend to have more cognitive resources. And phone selection, however, is actually driven by more intrinsic demographic features. And so we kind of came to the idea that if running a study on low-income respondents, it might actually be better to use a phone survey and remove that burden from the respondents back to the surveyor. Yeah, next slide, please. So I just want to talk briefly about data quality. And this is just a couple of things that we picked up along the way. So one was data cleaning for SMS surveys can be incredibly messy, and we actually had to manually clean our survey because of responses shifting or coming under the wrong variables. And also we had some open questions that were hard to understand without any context. And our consenting procedure was quite challenging in that it wasn't very flexible to pick up any response and know what exactly it meant. So that put us in a position where we had to devote a lot of time and energy to try and understand how the SMS responses were. Compared to this, our phone survey was actually really clean, and there was very little work to be done there, which was really nice. And then just looking at these two, about halfway through the process, we started to think about how to set ourselves up for tidier data. And some of this, in short, was done before should have been done before the survey started, by looking into how many character limits our SMSs needed, whether they made sense to respondents, but also setting ourselves up with the right kind of software and the right protocols to clean data as it was coming in. And the last one, which I hope that we'll talk a little bit more about today, is this idea of manipulation or attention checks, which we derived from MTurk and other online studies to try and check whether respondents were paying attention as we were going through these surveys. And one of the things that we found was they're incredibly hard to administer over the phone because they're not really designed to be heard, they're more designed to be seen. And then the other one was that going back to my first point, it was really hard to clean some of this data, so we couldn't actually tell whether the responses we were looking at were right for that question. And so one of the things that we're keen on looking into, and hopefully we'll be exploring soon in the future, is actually what should this look like for remote research. So just based on that, I'd like to conclude with three learnings that we had. Could you go to the next slide, please? Yeah, so overall, we found that choosing the right platform and software was really important to making sure that our SMS data was coming in the way that we wanted, but also we were sending it out in a form that would facilitate that by making sure that SMSs fell into the character limits that they needed, they weren't splitting up randomly and confusing respondents, things like that. The other thing that we spent a lot of time on was the number and framing of questions. It's really easy to put a lot of questions into a survey, and we spent a lot of time taking things out, making sure we were just asking about outcomes and covariates and nothing else that we didn't need. And that really helped us with our high data quality on phone surveys. And the last thing is something I'm sure all of you know really well, is to spend a lot of time piloting and testing. We did this for some, but I think we could have done so much more. And I think that's what we've pulled into a lot of our learnings. And one of the things that we've started doing is checking the data, especially from SMS responses beforehand throughout pilots, to make sure that it does actually look the way that we wanted. And that was something that really helped us out. So I think overall, we found that SMS was definitely the way to go for shorter surveys. They take quite long for respondents and have a lot of data quality issues if not managed properly. But if there's a short survey, say under 20, 25 questions, that's a really good way to go. And when there's a budget, phone surveys are really efficient and provide really high quality data. And optimizing pre-communications and timing to make the process even more efficient will help facilitate that process. So yeah, that's it for me. Thank you very much.
Thanks, Swani. I think I found the bit on incentives really interesting because some of it goes as you would expect and some doesn't. But thank you for sharing. I think, Shana, I'd like to bring you in as a research scientist on IPA's Path to Scale team and a PI on a lot of your Recover projects that focus on methods. Of course, the next step in conducting remote research is to actually find your desired sample and be able to do that remotely as well. So we know without census sample databases, it's either hard to reach your sample or certain groups get excluded. Through your presentation on the ways that you've tried to reach populations. How have you used things such as random digit dialing, and what are some of the mechanisms and processes you've tested to successfully optimize this process?
Thanks, Anisha. So good afternoon or good morning, good evening, depending on where you're located. I'm Shana Warren, and I'm a research scientist with IPA. Today, it'll be my pleasure to present some of our work on protocol optimization for random digit dial phone surveys as part of this panel on rich remote data. I'll be joined by Michael Rosenbaum from our Global Data Research and Support team, who'll be responding to some of the questions in the chat to keep our presentation moving. And an advance thank you to Michael. Next slide. So my presentation today will describe some results from IPA's Research Methods Initiative on phone survey protocols. IPA's Research Methods Initiative is a collaboration between IPA and the Global Poverty Research Lab at Northwestern that supports systematic studies into how to improve the methods and measurement of key outcomes in global poverty research. We aim to improve the quality and consistency in fieldwork through original research, such as embedded survey experiments. The Research Methods Initiative is divided into 3 themes: study design, fieldwork implementation, and measurement. In 2020, our focus has been on remote survey methods due to both pandemic remote research needs and also the increasing rates of mobile phone penetration and coverage in lower and middle income countries. Next. Thanks. So today we're going to be discussing some response rates and productivity questions, but the Research Methods Initiative is also working on questions of data quality, the role of attention, duration, and survey fatigue and response quality, how representative are random digit dial generated samples and what can be done to adjust them, whether some skills measurements such as cognitive skills in young children can be measured remotely, and then looking beyond enumerator effects to examine the role of enumerator and interviewer skills in producing high quality data. So if we take a step back and think about where do we lose respondents in a survey? So in a random digit dial phone survey, there are many opportunities to lose respondents. First of all, maybe the number doesn't work. And does somebody actually pick up their phone? I know many of us screen all of our calls. Second, during the screening process, we determine if the respondent is eligible for the survey by asking a few demographic questions, often age or gender, or perhaps geographic location. Notably, in most countries, the cell phone numbers do not give any information on geographic location, though there are a few exceptions. Next, we might lose respondents in terms of availability. Maybe someone wants to answer these questions, they're willing, but they might need an alternative time. I will suggest, however, that people rescheduling more than once could also just be a soft refusal. Someone might simply not want to directly say no. Then we get to the consent stage where a respondent determines whether or not he or she will participate in the research. As others have just discussed, this may be a function of compensation. It might be a function of how long the survey is or how busy the person is at the time. Finally, we get to completion. As in all survey research, we want to make sure that people who begin surveys reach the end of them. It is much easier to simply hang up on a call or have batteries fail or coverage fail than it may be just in person to walk away from a survey that's already begun. So today we're going to be discussing data from 10 random digit dial surveys. 8 of these were COVID impact studies, and 2 of them were consumer protection in digital financial service studies. Those were the Kenya and Uganda studies. Next. Okay. So to dig into the anatomy of a survey response, we begin with a case of a COVID study conducted with an RDD sample in Colombia last May. What do we learn? First of all, most of the numbers worked. This is because we purchased a sample, so we had good quality numbers, and that came out well. There was a steep loss in getting respondents to pick up the phone. So it worked, but now you have to get them to pick up. And then much smaller losses in screening, in part because in this study in Colombia, all adults were eligible. And almost everyone who agreed to the survey subsequently completed it. So once you get to agreement, we do well. The full graph illustrates the composition of response rates for all 10 RDD surveys. As you can see, the pattern is broadly similar. For all of these studies, we purchased lists of active phone numbers within the survey sites and screened for respondents over the age of 18. As can be observed in the first stage, percent working, this was a helpful investment as most phone numbers were operational. This saves a lot of enumerator time and frustration. I will note that in the case of Rwanda, the lower percentage of working numbers reflects how working numbers were coded, not the quality of the sample. In Kenya and Uganda, we had an additional screen for use of mobile money, banking or loans. And in Uganda, we also had quota sampling, which resulted in more substantial drop-off during screening. What's the big takeaway here? Cooperation, once you get consent, is really quite high. So this early rule of thumb to keep phone surveys to 15 or 20 minutes might need to be revisited. It may be possible to have much longer surveys. Next, we'll assess variation in response rates by date and time of call. Okay. So are there optimal times of day for RDD calls? Here we examine variation across time of day for the initial RDD call using morning calls as our baseline comparison. The first column examines call pickups and the second completed surveys. The estimates are percentage point differences from the baseline morning response rate. Latin American countries are yellow, African countries are in green, and the Philippines, the only Asian country in our data set, is shown in orange. So what do we learn? First, there are no universals about optimal call time. These findings are very context specific. We also can see that in 3 sites in East Africa, we saw notably less success in evening hours. But we caution that all of these surveys took place over a relatively short time period, 2 to 3 weeks. Evenings at a different time of year might yield very different results. Next. So then we looked to see if there were optimal days of the week. So this sample is restricted to the first attempt for each of the RDD calls. We did attempt numbers multiple times. The Monday column displays the average rate for Mondays only. The difference columns show the proportional differences to Monday from OLS regressions, which we ran with indicator variables for days of the week. Coefficients and standard errors are scaled by 100 over the Monday mean. Finally, in the far right, we look at the all-day average response rate. First, we observe that the average response rates on Mondays vary dramatically country to country. In some countries, it was simply easier to get people to pick up the phone at all. And overall, we again see that most of the variation is context specific, noting again that our surveys were relatively short duration and in a specific month. You can imagine factors such as regular afternoon rainstorms, for example, that might decrease connectivity in certain seasons, might have affected results. Each country has sort of a different set of what their best and worst days were. And we would strongly suggest, going forward with these, that in any study, you continue to gather data on this for your context, your time of year, your study population, because these may change. Next. So then we thought about how could a pre-survey SMS impact response rates. So this is separate than doing an SMS-based survey. This is just sending an SMS ahead of time so that when you receive a call from a random number, you know what it is. Okay. Although we don't see these strong effects on call timing and response rates, there may be other ways to improve them. So there are 2 places in this anatomy of a survey response where we can imagine this affecting our results. First, it can increase the probability that someone picks up the phone. And second, it can increase the probability that someone consents to the survey. Next. So what could drive changes in response rates? So in the universe of a no SMS, which you see on the left, there's some proportion of people who answer. Of those answers, some complete and some refuse. Next. Okay, maybe we can send an SMS and we can convert some of the refusals. So now you've gotten an SMS ahead of time and you know what the survey is going to be about. And now you're willing to think about it ahead of time and be prepared to say yes, as opposed to it being a call out of nowhere. Next. Alternatively, an SMS ahead of time can affect how people screen calls. There could be a few affected groups. You could screen out calls, those who might have answered the phone but wouldn't consent, that now know not to pick up the phone at all, which is a potentially negative impact. It is socially easier to refuse to pick up a phone versus to refuse someone in person. Or we could be screening in some calls. Next. There. So respondents who would not have answered are now going to choose to answer the call and complete the survey. Next. Thank you. So there are multiple paths to get the same response rates. And I would like to dig into this because it helps us to all think through what it means. So first, we have a scenario on the left where if you combine these, you can see an example situation where pre-survey contact drastically changes who answers the phone, but keeps the response rate almost identical. We have a near constant 30% response rate. In scenario 2 on the right, you could have very small changes, but still see a 30% response rate. Remember that in a random digit dial call, you learn nothing about those who don't answer their phone. It's just a phone number. It doesn't have a gender, an age, a location, or any other demographic information. So this begs the question of, does sample composition change? I don't have this on the slides today, but I want to note that we don't see changes on age, gender identity, a dummy for secondary or more education, a poverty probability index, or household size. But we can't know exactly what's happening with the churn in the designs that we've done. Next. Okay, so what were the effects? So these effects are in percentage points. Large effects are based on baseline completion rates ranging from 5% in Mexico to almost 35% in Rwanda. I will add that our Mexico study was specific to Mexico City. Mexico is one of the few contexts where cell phone numbers do have a geographic-based numbering system. So what do we observe for pickup? We see negative and significant effects in the Philippines, but not elsewhere. I will pause for a moment to explain better, sorry, I had skipped this earlier, the content of our SMS messages. So what we sent in these messages was who we were, what the survey was about, an estimate of how long the survey would take so that people knew what this was. In some cases, depending on country context, we provided a link to our website so that they could see that this was a legitimate organization and a legitimate survey. Next slide. So in this second row, we look at completions. And here we see a positive and significant effect in Colombia, Mexico, and Rwanda, but no notable effect in the Philippines. While we've presented a column that has overall effects, I would suggest that when you're doing a survey, you are not picking a context at random, you are working in one specific context. So you should look at that context only. So overall, in most sites, we find no impact on pickups, but a positive and significant impact of sending a pre-survey SMS on completion. This suggests that sending an SMS before your survey makes potential respondents more likely to want to complete your survey. We are also testing variation in message content, emphasis on how and to whom survey responses will be helpful, such as to help government plan effective responses to COVID, or to help researchers better understand the impact of school closures, this type of question. That work is ongoing. Next. Okay. So what should we take away from this? Can you go back? Thanks. So first, there are many ways to improve our work on RDD surveys. You should track your project in piloting and think through whether you should do more attempts to a given number, send SMS, or leave voicemails. All of this is very culturally specific. It seems obvious, but keep the start of surveys as short as possible and reduce ways to exit the survey. No one wants to pick up a call and receive, a really, really long consent script before they even get into anything interesting. But we could also revisit the advice of keeping surveys really short, because cooperation rates were high once we got through consent. People were willing to talk, and in fact, very excited to do so in many cases. We also see a lot of variation in projects, and this is something you should be aware of. More specifically, trust the knowledge and skills of your call center supervisors, your field managers. They probably see things that are unobservable ahead of time, but are key determinants of cross-country differences. Are there regular storms in the afternoon that are impacting connectivity? This type of issue. When is electricity likely to be out and phones likely to be dead? So we are going to be doing some more of this work for existing samples soon. Next slide. So what are we doing in our future research? Many things, but first we have a trial registered on the AEA registry where we describe a much richer set of contrasts for testing the effect of different message content, like efficacy. So between the first round of an RDD survey and the second, letting people know how useful their responses were in the first round. We'd also like to know, are SMS findings similar in other survey types? So our studies are specific to random digit dial surveys. If you have a survey where the baseline was in person, if you have an ongoing intervention, you might see very different results. So we are continuing this project. And second, we are focusing on how response rates and efforts to increase them affect representation and data quality. I would like to acknowledge the extensive efforts of Michael Rosenbaum in the data analysis and dozens of IPA staff in countries across the world who worked to make this research possible on a tight timeline. Thanks everyone, and I look forward to looking at the questions now that I'm done.
Thanks, Shana. There are quite a few questions. I found your point on not finding the optimal time of day really interesting. I think we always think that if you're a business owner, you should go in the morning. If you're targeting this other group, you should go at a different point of time. So even when we think about like context and countries, there are also strata within that are super interesting to look at further. And I think there was a question also that asked on the gender differences in either time of day or day of week. With that, Abhilash, as a manager at IDInsight leading innovation in phone surveys in your data and demand unit, I'd love to hear you build on some of what Busara and IPA have shared. I have two questions for you that I think you'll answer through your presentation. The first one is, we've been over how to choose your mode and then reach your sample, but what are some of your findings and suggestions on then keeping your respondents engaged once you've reached them? And secondly, we know reach and engagement might look different for different population groups, as we just spoke about. We'd love to hear more on what your learnings have been on trying to reach women specifically and keeping them engaged, and which countries you've looked at that in.
Yep. Thank you, Anisha. And thank you, Dhwani, Nicholas, and Shena. Those are really insightful points. So if you can skip the next two slides, and I'm going to try to answer that question through the presentation. So yeah, next slide, please. And the next slide. Thank you. So yeah, before I begin, just a bit of context. These learnings that I'm going to present are basically what worked for us and what didn't work for us. For all the phone surveys that we have done in India in this year and in the past, most of them being COVID response surveys. As Shina mentioned, there's like these are very contextual. So I would not take these learnings to be applicable universally, but like more than the points, like I hope that after this presentation, in terms of takeaways, you can take a few critical questions that needs to be asked in every context that we want to set up a phone survey in, and like how that shapes up the design of our phone survey. So with this introduction, if we can move to the next slide. As has been discussed, there are multiple stages of exclusion in a phone survey. And just to sort of give one more point of information, for IDInsight, for most of our surveys, based on which these results I'm presenting, were with a panel of households whom we had visited in person in the past, and that's how we had recruited them. So there are multiple stages at which exclusion can happen, and not everyone who owns a phone, not everyone would own a phone, not everyone who owns a phone would pick up. And for those who pick up, not everyone would consent or stay engaged. So in the first part, I'm going to talk a bit about our callback protocols and how we arrived at them. Then I'm going to talk a bit about some of the things that we have found useful in keeping the respondent engaged, and finally dive a bit deeper into reaching women respondents within households. So the next slide, please. Yeah, so we started out with like a pilot, right, to test the waters. And in the Indian state of Jharkhand, we gave our enumerators a set of phone numbers with no structure whatsoever. We just asked them to call multiple times, and we just wanted to see what would happen. And we experienced really low response rates, but we also had like interesting learnings on what are the different possible kinds of outcomes, and also how do we want to monitor our surveys to ensure that they are following the protocols. Next slide, please. So based on some research and like learnings from peer organizations, we realized that the callback protocol majorly varies on three aspects, which is the number of attempts we have to make, the time lag between those attempts, and how we are structuring the variance of those attempts within a day. So for our subsequent surveys, we adopted this callback procedure where we divided the day into three parts and kept making these attempts a total of 7 times until or lower if they are reached earlier. So next slide, please. And we tested this protocol in the same areas where we had done our pilot, and we found much higher response rates, which provides some indicative sense that structured callback protocol, at least in the Indian context, was useful. So to provide a bit more statistics on what we found while we followed these callback protocol, next slide, please, is that there's like, we reach respondents in the earlier attempts, right? Like as the number of attempts increase, the number of respondents we're able to reach in any particular attempt decreases. And next slide, please. We see that there's like a diminishing marginal return of more attempts. We don't want to specify like a universal number of total attempts. 7 worked for us well, but I think this is something that researchers have to sort of decide for themselves, given, depending on the context of the study. But in the next slide, we basically try to split these reach rates across income quartiles. So the trend lines that you see correspond to like 4 different income quartiles. And as you can see, they are very parallel. So more number of attempts does not disproportionately increase our chance of reaching any particular income quartile. So that was like one key takeaway and that we got from this experiment. Next slide, please. And finally, like I'll not spend a lot of time on the optimum call time in a day. I think like a lot has been spoken on it. In India, we found that morning slots worked really well. But I don't want to echo what Sheena said, is that it's very, very contextual and really depends on the kind of respondents that we're trying to reach. So for example, in Uganda, we did a phone survey where we're trying to reach respondents who resided in a refugee colony. So there were very strict time windows in which we could reach them. Similarly, in Ghana, we were trying to reach parents of school-going kids, and evenings worked out to be best in that scenario. So this, all of this is contextual, but this is especially like a contextual learning. So next slide, please. So basically, from this section, like the key questions that we want to take as takeaway is like trying to understand who are our respondents, when they might be available, and how likely are they to pick up the phone. Those are some of the questions we should be asking from like a callback protocol perspective. So moving on to the next section. Next slide, please. So I'm going to talk about like some considerations that we explored in terms of improving engagements. One key thing to understand is in an in-person survey, both the surveyor and the respondent rely a lot on each other's facial gestures to understand if they're listening, if they're understanding what the respondent is saying, and that's simply absent in a phone survey. To sort of make up for that, like we have found certain things useful. So for example, surveyors giving verbal cues as the respondent is responding to give an indication that yes, we are listening or we are able to understand what you're saying. That's especially useful, making them comfortable. If you're reaching someone who may not remember us or does not know us, I think like having an introduction and telling them why we are calling is extremely important. Next slide, please. We tried out mobile airtime top-ups as incentives. So in some of our surveys, we randomly divided the respondent group into receiving incentives and not. And in one of the group, we did mention at the beginning of the survey that if you complete the survey, you're going to get like 100 INR mobile airtime incentive. This did not seem to have like a significant difference in response rates. But the caveat I would throw is that mobile airtime was the only kind of incentives we could experiment in India. So there may be other kinds of incentives that may increase response rates. And finally, on questionnaire, I'm going to dive a bit deeper into it in the next section, but we wanted to understand or get a sense of what kind of questions usually work, what kind of questions are a little problematic, and we experimented with a range of questions. We usually found that yes, no questions usually work well, but except for questions around sexual behavior, we found that rest of the questions really had a pretty low refusal rate, and that was like an encouraging finding for us. So moving on to the next section, I'm gonna and so basically, just to summarize takeaways from this section, I think like questionnaire framing and designing consent scripts, especially attuned to the kind of population that we want to reach, are some of the critical points that needs to be thought through at this stage of survey design. So moving on to the next slide, we're going to talk about like reaching women. So for a lot of our surveys, we have women respondents. This was especially true for our COVID response surveys, where we were trying to assess the potential differential impact of lockdown on women within households. And I'm going to talk about 3 things that we're considering under this section. But before that, like it's important to understand why this is a challenge in the rural Indian context, and probably at a lot of other places as well, is that it's a very male dominated patriarchal society, and like the phone ownership within the household is most likely would be with the male person. So there are very stringent cultural norms against like a stranger male, which is the surveyor in this case, talking to like a female respondent within the household, which is why, and given the fact that a male person would be picking up the phone, it's very likely that they won't pass on the phone to the female respondent. So theoretically, using female surveyors should mitigate this problem to some extent. And if you go to the next slide, we did try this, and in India, it seemed to work. We had a significant higher reach rate when female surveyors were trying to survey female respondents, but it's also useful to mention that we had mixed evidence from other geographies. But I think by and large, from a qualitative sense, it's more comfortable. We feel it's more comfortable for female respondents, and also their male counterparts if it's a female survey calling and trying to ask some questions. So moving on to the next slide. The other issue is, drawing from the previous slide, is that it's a male person who is picking up the phone. And we found that a lot of times when female respondents were exclusively our intended responders, the male person would just simply deny or refuse to pass the phone. And so one of the things we want to try is to make that person comfortable. And so one of our interventions was we would ask a few questions to the male person who picked up the phone, even if he's not the respondent and the data he's giving is not really serving the purpose of our research. We would still go ahead and ask a few questions, spend a few minutes talking to that person. And once we feel he's got a sense of the kind of survey it is, we would then ask to pass on the phone to the female respondent. We do feel that this method worked. We saw an increase in the number of male respondents who agreed to pass to the phone to the female. But the caveat here is like a big proportion of them also said that the female respondent was unavailable. So we don't have a good way to know whether that was a genuine case or that was more of a disguised refusal. And then moving on to the last section of the presentation, I'm going to talk a bit about sensitive questions. So it is true that we do not have full visibility on the level of privacy in a phone survey. And it may be true that when we're asking sensitive questions to a female respondent, a male person in the household might be overhearing. So this has huge ethical implications. At the same time, this also brings in the concerns of social desirability bias, and our data that we're collecting may be biased. So at the outset, it's possible to, it's best if sensitive questions can be avoided, but I'm going to talk about if they have to be asked, like what are some of the considerations in the next slide. So it is true that sensitive questions will cause a bit of discomfort, and specifically if we're asking questions that they can also amplify the risk for the respondent. So for example, if you're asking about gender-based violence, that can, and if someone is overhearing the answer, that can have like pretty huge negative repercussions. This was one of the reasons we decided against asking gender violence question. But some of the ways to go about this, that we have found useful, is to heavily depersonalize it to the extent possible. So in Uganda, for example, we found that respondents were very okay talking about and acknowledging that alcohol consumption and overuse was a problem in their community, but they were not really open to talk about like alcohol consumption within their families. So taking the question at a community level, asking questions through vignettes or hypothetical scenarios, all in the attempt to depersonalize this question to the extent possible can be really useful. And then the last consideration, which is in the next slide, is framing this question. So like giving some sort of intro script to this question, the sensitive questions, rather than jumping in straight, was found to be useful. So when enumerators when they were asking about mental health, when they spoke about their personal anecdotes or things that they spoke a bit about their story and then asked the question, that elicited more responses. And the second is, it's useful to have sensitive questions in the later half for two reasons. One is that it may be that someone is overhearing in the initial half, and if we keep it limited to generic questions, that we may have a better privacy situation if sensitive questions are asked later in the survey. And the second is like after we have asked a few non-sensitive questions, it will help them build a good rapport. So these are all our considerations, and I conclude here. Hope that was helpful. Thank you so much.
Thank you so much, Abhilash. Your depersonalization question is well taken, point is well taken. And I think we tend to think of similar ways to ask questions, but if anything, in the last year, we've seen increasing need to combine like qualitative methods with quantitative surveys and find the best balance of like, what do you use for which question to actually get useful responses. With a focus on how can we make all of this actually happen, Sarah, I'd like to invite you to share your learnings as a senior research manager at JPAL Global, where you work to improve research operations with a focus on resources. Could you share some of your insights and takeaways into how and where resources should be invested most? For in-person work, we know the implementation process is so key and takes up a large chunk of time before it runs smoothly. What does that look like for remote research, and what have you found?
Thanks a lot, Anisha, and thanks everyone for joining today. I'm going to be joined in the chat by Tithi Mukhopadhyay, who is the Director of Research at JPAL South Asia, and I think Putul Gupta, the Associate Director of Research in JPAL South Asia, is also joining, though they both have some internet issues, so they may be in and out. Next slide, please. Okay, so before I get started, I just wanted to give you a brief overview of JPAL's COVID response. In March 2020, we halted all in-person research per guidance from MIT, and at the time we had over 200 active research projects, around 90 of which were implemented by our regional offices, and then an additional 120 or so that we were funding. Over the spring and summer of 2020, we funded 34 COVID-19 research proposals, awarding around $1.5 million in total. Our regional offices and affiliated professors also partnered with governments around the world, including in Chile, India, and Indonesia, to provide insights from the RCT literature into COVID response. At the same time, our regional offices were also focusing on adapting research protocols to remote surveying in order to minimize the disruption of research. This was, of course, not always a smooth process, so today I'm actually going to share some anecdotes of the challenges we faced and lessons learned as a result. I'm going to focus on insights drawn from two of our projects in two of our offices, the two offices where the bulk of our 2020 phone surveying occurred. The first is our JPAL Southeast Asia office, which is based in Indonesia. In partnership with the Jakarta provincial government and as part of its COVID response, JPAL sent an online survey to over 34,000 parents and nearly 1,700 teachers across 114 schools to better understand the implementation of a learning from home program. We then followed up with 258 of these respondents for in-depth qualitative interviews over the phone. Two other recent phone surveys done by JPAL Southeast Asia included gender study and the latest round of a panel study on international migration, and I'll draw some insights from these as well. I'm also going to bring insights from 35 projects implemented by our South Asia office in India. Of these 35, 7 were standalone COVID projects, and an additional 11 had a COVID component. The projects were across a range of sectors and involved over 400 enumerators in total, many of whom were trained in the midst of India's strictest lockdowns, when movement was impossible and it was impossible to deliver to surveyors any sort of project-specific devices. In discussing these projects, I'm not going to include information about recruitment, sampling like the reuse of data or the use of publicly available data to create sample frames, et cetera, or protocols for calling, because they did vary quite a bit by project. Next slide, please. Okay, so I'm going to talk a bit about some challenges. The first is survey duration. I won't spend too much time here because it has been covered a bit already, but a challenge discovered by our Southeast Asia office in early rounds of piloting for the in-depth qualitative interviews was that it was very difficult to keep these interviews of manageable length, particularly when enumerators had to think quickly on their feet to respond to something an interviewee had said. The office overcame this in a couple of ways. First, it undertook many rounds of testing to whittle down questions to those of top priority and to identify when the respondents had provided enough information and the interview could stop. They also created an extensive set of possible scenarios of respondents' answers and used these during enumerator training so that enumerators would be less likely to be caught off guard, could answer more quickly, and then the interview as a result would flow better. With these protocols in place, they did not need to break up the interview over multiple rounds, though of course this is an option if needed. Next slide. Another set of challenges concerns module type. So as an example, a project in India that was collecting information on immunization realized early on that it was very, very difficult for respondents to keep track of immunizations and children over the phone. For example, let's say you're collecting data on 5 different immunizations for a household that has 5 children. 25 data points. That's difficult to remember for a survey that's done in person. Even harder if it's completely over the phone and you don't have immunization cards or records in front of you. And that means that the data that you're getting is likely subject to recall bias and probably not going to be of the best quality. Here, a potential solution that we came up with would be to focus on only one child, say the youngest child, or to collect data at the household level rather than the child level, or to focus on only a specific instance or immunization, whatever makes the most sense for the project. In our case, the team decided early on that if the respondent did not have an immunization card at hand, then they would not go through the entire list of children and immunizations and for the roster. But either way, focusing only on what's most needed rather than getting a comprehensive record of immunization for every single child in the family will likely give you much better data in the end. I'd note that this general advice of simplifying modules and questions as much as possible applies to other complex questions like Likert scales or rankings. So for example, asking respondents to rank 10 different options that are read out in a long list is probably not going to get you very good data. They're going to forget the first, say, like, well, if it's me, probably 7 or 8 options and only remember the couple at the end. An alternative then would be to read out each option one by one and to ask the respondent to say yes or no one by one as you go through. Of course, to identify what might be complex questions to answer over the phone, you do need to pilot modules and questions very carefully, and then be prepared to shorten or restructure them if needed. Another tip to reduce cognitive burden on respondents that I think was mentioned earlier is to leverage data from earlier rounds and use pre-fills as much as possible. And then finally, again mentioned earlier, it's important to train enumerators so that they can respond or they can recognize when a respondent's having trouble with a question and then themselves respond appropriately. Such as by breaking it down further, as in the ranking of 10 options that I gave earlier. It's especially important to focus on this in training because it's harder to pick up on respondents' confusion or trouble with the question when you don't have visual cues to aid you. Yeah. A lot of projects leveraged audio recordings to conduct virtual spot checks by listening to the audio recording and virtual back checks by comparing the audio recording with the data set or transcript. But audio recordings only take you so far, and the remote setup made real-time communication with surveyors difficult. It was particularly difficult to identify challenges faced by enumerators and then to provide timely feedback on their delivery, as well as to communicate errors and get clarifications from surveyors remotely, especially on large-scale projects. Our South Asia office dealt with this in a few ways. One thing they did was to begin holding daily debriefs, both with the team and then one-on-one between surveyors and supervisors, which then served as a platform for teams to exchange learnings and to provide feedback. They also moved to a more decentralized team structure so that teams could more easily communicate challenges, errors, and clarifications, and bumped up the surveyor to supervisor ratio, moving to more like 3 to 4 surveyors per supervisor. It was also important that surveyors were aware of the various monitoring and quality control measures in place so that they understood upfront that their work would be carefully checked despite the fact that the setup was completely remote. And then of course, all of these monitoring and quality control activities do require additional resources, which has budget and staffing implications and requires upfront planning at the outset of the project. Next slide. A final challenge I'll touch on relates to response rates. We expected low response rates, but were surprised by how variable they were, ranging from under 40% in some cases to over 90% in others. Looking at the projects with higher response rates, we noticed a couple of things. Again, sort of echoing some of the insights that were shared earlier. The first one was that getting a foot in the door, such as by partnering with government or an earlier communication, was crucial. So as an example, for the Learning from Home study in Indonesia, the government provided JPAL with a letter of support of the project and then actually helped endorse the survey by informing parents and teachers that some of them would be contacted by JPAL for interviews. The online survey sent out to these 34,000 parents had been distributed by the schools, which lent an air of legitimacy, of genuine legitimacy to the project, and actually resulted in fairly high response rates for an online survey. It was nearly half of the 34,000 parents responded, and nearly all of the teachers who were contacted responded, which I think is sort of the upper bound of what we could expect for an online survey. And in this online survey too, respondents then consented to be contacted for later follow-up. So the 258 respondents for the qualitative phone surveys were easily contacted, and we did not have to worry too much about refusal rates. This has already been said, but bears repeating, but the time of day at which you call is important. In our particular context, the South Asia office in India found that women were more likely to be available to speak in the latter half of the day, often because they were busy with chores in the morning. And then in the evenings, if the women did not have their own phone, they could be reached on their husband's phone. Men, on the other hand, were more likely to be reached before or after work. So early mornings or late evenings were best. And again, I think as has been stressed several times today, this is all very context dependent, but this is what worked for us in India, at least. But as a result, when we see these times at which respondents are available, it suggests that surveyors also, to be able to reach respondents, surveyors need to have flexible work hours so that they'd actually be working when respondents are available. Our surveyors worked 8 to 9 hours per day, but they weren't standard working hours for the most part. They were working in the mornings and the evenings when respondents were available. They've actually had the additional benefit of lowering barriers to work for female surveyors, because the flexible work hours allowed them to adjust their schedules based on both respondent availability and household duties. And reassuringly, the projects that provided these flexible work hours did not find a significant difference in productivity for male versus female surveyors. Next slide. So just to wrap up, I think the top line recommendation from all of these challenges we faced and what we've learned so far is to invest heavily in the setup, at least as much as you would for in-person surveys, but to be thinking about these issues from the outset. So this includes spending a good amount of time to identify surveyors who have the right skill set, which includes fluency in the various languages that respondents may speak, capability with the software the project is using, as well as the software that you're using for remote trainings, ability to establish a rapport over the phone, and so on. It also includes spending extra time for training. Even though the questionnaires will be shorter, enumerators will have to practice additional skills, like the ones I mentioned, as well as which also include protocols for making calls, recording call attempts, data flow, and data security, all of which are going to be slightly different and in some cases more complex than they would be for in-person surveys, with the added difficulty that enumerators will have less direct supervision than they normally would. As was also mentioned earlier, enumerators do need slightly different soft skills for phone surveys. They have to practice getting through gatekeepers to reach the respondent if someone else picks up the phone. They have to practice building a rapport with the respondent, which again is particularly tricky to do without visual cues. So it's worth to invest the time needed during training to make sure that surveyors get the introductory script right. Ensuring that enumerators are doing this well requires many practice sessions and mock surveys, as well as additional training resources. One practice we found useful was to train a small team of senior staff ahead of the actual training so that there'd be smaller groups and breakout sessions and more hands-on supervision by senior staff. It was also helpful to build visual aids and other resources to help surveyors retain information. So an example from the immunization module I mentioned earlier was a series of flowcharts and pictorial representations. Surveyors then went through the module many times in small group and one-on-one practice sessions until they got it right. And of course, pilot surveys and protocols many, many times. As with in-person surveys, but especially with phone surveys too, you should just be piloting until you get it right. This may require more than in-person survey piloting would lead you to expect. And I'll just wrap up by saying we have a number of written guides on lessons that we've learned from remote training, budgeting, and more that you can find on the COVID response page of our website. We can paste a link in the chat as well. And we're also releasing some new resources on phone surveying considerations that you should expect to see in the next couple of weeks.
Thanks, Sarah. I think we'd be super interested to see how we can standardize some of these upfront investments across organizations. But I think it's time also to open it all open it up for everyone in the audience. Nenga, we can stop screen share as well. Yeah, so I think there have been a stream of questions that have been coming in. We've tried to answer most of them on the go, but there were some larger themes that I wanted to pick out. I think we can start with some of those. And for everyone who's here, please continue to put your questions. We'll take those as well. Great. So I think one question that's been on my mind and came up maybe in different ways is looking into the future. How do you envision remote research playing a role in the long term? Are there components that you think should always be done remotely and complement stopgap solution for the pandemic times? Shana, maybe do you want to go first?
So in terms of the stopgap and pandemic question, I think this is a really good one, and I think it depends a lot on context. So something I didn't speak about today, we did a random digit dial survey in Kenya, and we got a very broad representation of the country, and this is linked to phone coverage and phone ownership. We made an attempt at random digit dial surveying in Nigeria and found that it was not an effective way to reach Nigerians, and that we were getting a very narrow subset of Nigerians. So I don't think there is a universal answer on that. I do think that in general, starting from a sampling frame where you have some demographic information ahead of time makes doing phone surveys much easier. I think that a random digit dial survey is important when in the context of a pandemic, but it's not how we would generally think about recruiting samples for, a large scale intervention. Otherwise, I think there's a lot of work to be done on figuring out how to take the long questions that economists and the huge questionnaires economists tend to ask. A long consumption module simply can't be achieved in a phone call. And really doing some serious work to figure out what are the core questions and what is really giving you information. For example, in our surveys during COVID, we quickly found that a simple binary measure of whether a member of the household had a formal sector job was highly predictive of a slew of other financial resilience measures. But you don't know that until you attempt it. So I think there's a lot of work to be done on what these key questions are that might not be the nice, neat, perfect consumption module, but will give you the bulk of the information very quickly on the phone. And I'll leave it there for others.
Yeah, IDInsight, Abhilash, Mitali, do you have thoughts on what it's looking like in the future?
Sure. Yeah. I mean, I think one of the primary areas of further research for us in order to answer this question is investing more on figuring out the quality of responses in phone surveys. So one of the go-to things to do would be to do a mode comparison, but with the so-called gold standard of surveys, which is in-person surveys and phone. The reason I say this is I feel phone surveys are much faster and cheaper than in-person surveys, which sort of ties into the fact that they make data more accessible. And there's more research to be done on the quality of phone surveys, which is why I think for the future, what's important for the sector is to do more research on quality, because I feel it's sort of unfair to treat phone surveys as secondary, and only do it if in-person surveys is not feasible. I agree that for a lot of questions, in-person surveys is not replaceable, and through measures and stuff like that. But I feel more research on quality through randomized mode effects would be the way to go. And I do feel that for this for the research world in the future, phone surveys would play an even important role if some of these quality aspects are nailed down. Yeah, that's it.
Yeah, that makes a lot of sense. I think relatedly, and maybe Busara team, besides phone and SMS, have you seen any other more innovative tools being used recently that might carry through post-pandemic as well?
Sure. I mean, obviously there is also literature on things like IVR, which is obviously a useful method that approximates, I guess, an SMS survey in the way that it's queued and prompts responses, but is open for non-literate populations. But there is also evidence to show that that seems to be one of the least reliable methods in terms of response rates. And so, that's a consideration. Web surveys and online surveys are something that's proliferating. Obviously, there are some limitations to these in terms of the fact that the sample has to have internet connectivity, and you might imagine, harder to reach populations, this presents something that's even more challenging. At Busara, we're currently developing two tools that are supposed to aid this. One is a survey tool that is a very lightweight app that provides like a researcher interface to conduct basic surveys that respondents can do offline, and that is very light on devices and can be used on basic Android versions up. Obviously, still going to have selection effects there, but this is hopefully a tool that might be useful in the future for collecting data with a broader group of respondents. And then similarly, there's also passive data collection tools that, in some cases, for example, we also have this tool that's a phone sensing tool that passively collects phone data and is indicative of certain behaviors. But obviously, more granular attitudes and these kinds of things that require more survey type responses, that's not going to get at. I don't know, but then, you get like the more aggregate level data, such as, I guess, satellite data, these kinds of things that, you can think of using. But in terms of actually getting respondent specific data, yeah, we're starting to develop some tools that work towards this.
Nice. I think there's a related point and question that's come up a lot in the last 1 year on like offline community, reaching people who don't have phone and can't do your SMS or phone surveys. I don't know, Sarah, do you have experiences in how to reach communities which don't have even telephonic services or IPA? Have you?
Yeah, I think our experience so far has just been, I guess, sort of leveraging the access that already exists in the community. So if we're thinking about respondents within a community, a connected community, but the respondents themselves aren't already connected, we can sort of leverage their access that way. I guess just to echo sort of the overarching theme of what's been discussed so far, I think we've really seen this year how important it is for everyone to be connected, because there's so much more that you could be doing remotely. Beyond remote data collection, I think we've seen a lot of innovations in remote delivery of interventions through mobile money payments, sending short video clips to 25 million Indians in West Bengal and so on. And I think that there's a lot of scope for governments and for private sectors to really be investing heavily in connecting people worldwide.
Shana, Michael, do you have thoughts on the intervention delivery as well?
Sorry, you were garbled on my end.
Oh no, I was just saying, related to Sarah's points, you also focus a lot on intervention delivery, right? How have you seen that play out? And how do you think that would look in the future?
Again, I think I had spoken about this earlier. This is really context dependent. There are places where you can reach many more people. There are places where phone coverage might allow people to receive a short video or an image. And then there are other places where that would be well beyond the phone plans of so many respondents that you'd be narrowing your sampling frame. So I think here you really need to consider, who do I want to answer to this survey, and who would be excluded by using a particular methodology. So if you think about IVR, you're excluding individuals with insufficient literacy for that. It's also deeply awkward on a non-smartphone to respond to more than a couple of those questions where just a little bit of text fits on the screen. So I think you have to consider coverage and just logistically, what is the experience going to look like for a respondent, and how would you motivate them to want to participate? So there are some contexts where sending a WhatsApp message would be really practical. There are others where many people wouldn't receive it. There are other places where Facebook Messenger is an appealing approach. All of these sort of logistics around the intervention. I also would suggest that when you send messages, you are cautious about where you send them from. With enumerators working from home during the pandemic, this meant that they had phone numbers and were sending messages, and we needed to make sure, of course, that they were not sending them from their personal phone, particularly when dealing with sensitive topics. Anyway, a lot of variation across platforms.
Yeah. I'm going to take you up on what you said at the end on sensitive topics. I think there were a few questions in the Q&A that came up on that as well. I think there's obviously increasing need, as I said, for like a mix of qualitative and quantitative methods, but in some of your experiences, I know IDInsight shared how they used vignettes to ask a few questions. Maybe Busara and then Jpal, have you tried any ways to ask more sensitive either topics or work with more sensitive or vulnerable populations during the last year and a half?
Yeah, I can speak briefly about that actually. So we've also done a lot of vignettes in India. So I'd actually be very interested in comparing notes in more detail, Abhilash, at some point. But yeah, we found that vignettes kind of, they work if you set them up well. So we've had some vignettes where respondents totally saw through it and knew that we were asking about them. And then we've had some situations where they worked really well because there was like the adequate amount of distance, and just like any other outcome measure, it was really important to try and get that combination right. For some of the work that we've done recently at Busara, we've been working with either vulnerable populations or just populations that we haven't been reaching before, as well as populations that, as well as topics that are very much, very sensitive and we wouldn't know how to ask about them. So a lot of work on gender and social norms in India. And to do that, we've really relied on the community to help us reach out to people. So we've actually worked with grassroots organizations, even though we have that presence in the locations that we work in. So very local, regional groups, and try to, instead of training our own enumerators to go into that area, we've actually found people from that area and trained them on how to do this. And it's turned into a partnership where we've actually been able to provide a very safe space for these conversations to happen, as well as share that research back with the people who were interested in it and who have now actually participated in collecting that for us.
Sorry. Sorry, go ahead.
Just a question that I found, I think it was Abhilash's presentation where there was a little bit of discussion on sensitive questions and the placement in the survey. And I was just wondering how that was inferred. But I mean, I think Sarah by all means respond first, and then I would personally like to hear how they inferred where the position in the survey was. How they determined that.
Sure, yeah, I guess not to repeat what has already been said. I think the other thing that I would highlight is just the protocols around calling. So being very careful with the introductory script and first ensuring that the respondent is alone and in a safe space and being able to call back if not, and also being careful that you aren't sharing information that, say, you're asking about IPV in the introductory script before determining that the respondent is in fact alone. Another thing that we found useful is just to take a lot more time with informed consent, as well as questions around participation and protocols, and build a rapport with the respondent very early on, especially if it's the first contact with them.
I can also quickly jump in on this question. So for a lot of the questionnaires where we actually did have a couple of sensitive questions, I just wanted to highlight, go through some internal ethics review and IRB first, just to make sure that, we do feel comfortable asking these questions for the safety of the respondents. We did do one experiment where we tried changing the location of the sensitive question and found that we had the lowest refusal rate when it was like in the middle, so not too early on and not too late on, which is sort of similar to findings about in-person surveys. And the one other point I wanted to make about sensitive questions that I think has been highlighted a bit, but was just that focusing on training surveyors is really important here, and doing your due diligence research on what resources are relevant and are actually active and in use. So for a lot of the surveys we did with women respondents, where we did touch on sensitive questions like gender-based violence, we did gender sensitivity trainings with surveyors, and also had distress scripts with helpline numbers in case a woman was suddenly distressed and we wanted to call and make sure that those numbers were working, had like different language accessibility, etc.
Yes, that makes sense. I'm going to move to wrapping up since we're actually ahead of the 1.5 hours. I know, Shina, you might have a point on intimate partner violence from your work, so maybe we'll move to you. And alongside that, you can just share some thoughts on, we've spoken a lot about like traditional questions and even complex rosters, tabulations, how do you move those? But there are a few questions on how do you move more task-based questionnaires. And I think Busara might have this on some of the behavioral games that you try playing as well. So maybe if you could answer that along with share your IPV thoughts, and then we'll move to wrapping up.
Okay, so let me go through this quickly since we're almost at time. I would first suggest that a key component of considering asking very sensitive questions that might put a respondent at risk on the phone is to do a careful calculation at the individual level, like what is the risk benefit of asking this question? We also found that asking consent, we asked repeatedly. So we let people know that these types of questions would be in the survey at the beginning, because if a woman was sitting next to her abusive partner, it would be helpful to have that question and then have a whole bunch of not very sensitive questions. And then in the IPV section itself to really build up so that it's not just about IPV, but about domestic violence in the home, violent arguments between children. So you can sort of work your way up. And we asked consent on multiple occasions, and we included information on who to contact with difficulties, and also some discussion with enumerators on how to deal with this, because hearing on a phone call for someone you can't assist in any way really, that they are suffering from domestic abuse can be very traumatic for your enumerators as well, and they need to be trained to deal with that. In terms of task-based measurement, so at IPA, Steve Glazerman has been working on this topic. You really, on a phone survey, again, you have to limit sort of the cognitive challenge of a task. If you think about being asked a multiple choice question, there's only so many choices you can keep in your head. An enumerator face-to-face can look at someone and see when they're beginning to get lost, but you get no feedback like that over the phone. So in some of our work, we've started to look at breaking something up into smaller components. On the question of household rosters, we made some attempts at this, decided it was too complicated in piloting and took too much time. So we settled for some questions about age ranges, how many boys between, primary school age boys, how many primary school age girls. In some contexts where there are more children in the household, it can become unmanageable. When there are, very few children, you can ask for specifics. And then later in the survey, if we wanted gender differences, we had a randomization protocol to ask about a secondary school aged girl and a secondary school aged boy, for example. And I'll leave it there for others.
Do JPAL, then IDInsight and Busara. So if you have any thoughts on what you think the future of research on research should look like, if you could share maybe 1 or 2 sentences there.
Sure, I'll reiterate what I said earlier, and I think what's been touched on is that better understanding data quality for different modalities, and then also thinking more creatively about what more we could be doing with respect to intervention delivery and so on.
Thanks. Yeah, I mean, I think in the interest of time, I would echo that it's, I think for us also, it will be the data quality of modalities, especially because we do want to use phone surveys more and more, and not just as an alternative to in-person surveys. And hence, when the world allows us to do in-person surveys, we would love to do a mode comparison.
Yeah, I think from our side, I think for me, the 2 most pressing things, I will again reiterate the need to assess data quality across these different modes and think hard about specific ways to measure that with the current data that you have and looking through. So we've been doing a lot of work on reliability and validity checks of different instruments and how they play out across modes, but also developing and applying across as many projects as possible, data quality checks that are parsimonious and can be used in different studies and compare. And then the final thing is just that we're doing research all the time, and they necessarily require us to do them in a specific way. And so it almost always makes sense to try and embed method studies in the studies that you're doing as often as possible. And this can be done really cheaply and in a way that doesn't affect the validity of the rest of your results. And so I just encourage researchers more and more to try and embed randomized control trials of small methods components in the work that they're doing as often as possible.
Yeah, I think we all agree with that, and the call to action seems to be to continue to focus on quality across your substantive projects. And with that, I think we're just 1 minute over time. So thank you all for everyone who joined today. Thank you to the panelists. We'll post a recording. There were a lot of questions on this. We will post a recording of the audio as well as the slides on all our respective websites within the next few days. So if you missed any component, you can look for it there. Feel free to also reach out to any of us if you still have specific questions for organizations or people or studies. Thank you so much, everybody.